Good afternoon, everyone. Myself, Dr. Deptee Warikoo, Department of Physiotherapy, Dolphin PG Institute of Biomedical and Natural Sciences. Our today's topic is DOMS. DOMS stands for Delayed Onset of Muscle Soreness. It's also known as muscle fever. It is a sore, aching, painful feeling in the muscles after unfamiliar and unaccustomed intense exercises. So let us see what happens in DOMS. Delayed onset of muscle soreness is muscle pain. It begins after workouts. It normally starts a day or 2 days after your workout. It also known as exercise induced muscle damage or EIMD. According to American College of Sports Medicine, this symptoms typically occur up to at least, as I told you, 12 to 24 hours after a workout. The pain tends to peak about 1 to 3 days after your workout and then should ease up after that. So the soreness starts day following whatever activity you have done. So as I told you, it is also called as muscle fever. Such a wonderful descriptive term because the muscle goes for feverish symptoms. Now before that, what is acute onset of muscle soreness? As we are seeing the topic as delayed onset. So what is acute onset of muscle soreness? This is pain felt during or immediately after a workout is different kind of muscle soreness. It is called acute. Acute is that burning sensation you feel in a muscle during a workout due to sudden build-up of the lactic acid. It usually disappears as soon as you stop the exercise or shortly after that. It develops during or directly after the strenuous activity and as you exhaust, but when you start relaxing, it will start diminishing. It occurs as the muscle becomes fatigued. That could be lots of reasons like lack of adequate blood flow, temporary blocking of the oxygen, temporary buildup of metabolites. This type of soreness is characterized by burning or aching sensation within the muscle and it will subside quickly after the exercise. We can use appropriate warm up and appropriate cool down to decrease or diminish the kind of sensations in acute onset of muscle soreness. So this is about the acute onset of muscle soreness. Now let us see the timeline of delayed onset of muscle soreness. So as you do a strenuous eccentric activity, for example, it will start after 8 to 12 hours and then peak at 24 hours to 48 hours and then start diminishing till the 96 hours. So generally after 96 hours you will have loss of delayed onset of muscle soreness. So we all know that what is it? It is basically when you start working out, intense activity, day 2 you will start this feeling mildly and day 3 there will be storm of pains. After 96 hours it will diminish. Now what causes DOMS? High intensity exercises can cause tiny microscopic tears in your muscle fibers. Your body responds to this damage by increasing in the content and the rate of inflammation. This may lead to a delayed onset of muscle soreness. Pretty much any higher intensity exercise can cause DOMS. And we always say that if you are not accustomed for eccentric activities and you do suddenly eccentric exercises, then this can trigger your DOMS. Eccentric exercises cause you to tense a muscle at the same time as you lengthen them. Okay, that is what is the basic reason for your DOMS. Like you are running a downhill is an eccentric activity. When you are straining your forearm after a biceps curl, this is a eccentric activity. These are the types of eccentric activities. Now if we talk about the pathophysiology, we have to see what happens in the eccentric activities, the micro injuries that occur. Basically, they depend on the intensity and duration of the activity. So there are 6 hypothesized theories. First is the lactic acid content. Second, the cause of muscle spasm. Third, connective tissue damage. Fourth, the muscle damage. Fifth, inflammation. And sixth, the enzyme efflux theory. So these are the basic things. Now what happens? Eccentric muscle contractions result in greater disruption to the structural elements of the muscle and connective tissues than what we can suspect in concentric exercises. That is why DOMS is more intense with eccentric activities. That is the reason why DOMS will be seen morely in eccentric activities. Now see, this is the basic things what will happen here. The structural disruption has sufficient evidence by histological studies that there will be structural disruption. So eccentric contractions recruit fewer motor units and thus the force generated is distributed over a small cross-sectional area of the muscle. This increased tension put unit area causes greater injury to the tissue. However, there is still ongoing research to establish a direct relation. So we could say that in the muscle fiber, what happens if there is a strenuous muscle contraction? This causes damage to the sarcomeres inside the muscle. This damage is caused to the sarcoplasmic reticulum, that is the reticular membrane in the muscles. Now what happens when the sarcoplasmic reticulum is damaged? Here you could see the calcium leaks out of the sarcoplasmic reticulum and is collected in the mitochondria, that is the powerhouse of the cell. Then the muscle cannot produce much ATP, the body's immediate energy source of fuel, as we all know. So this buildup of calcium also activates enzymes which break down the necessary proteins, which are very important for muscle contraction. Next, the membrane damage combined with the breakdown of muscle protein. एक तो membrane damage हो गई plus protein भी आपका loss हो रहा है, breakdown हो रहा है. So this results in inflammation or swelling and increased histamine. Now we all know what is histamine, a chemical that causes inflammation. As histamine is there in increased content and free radicals production is there, this stimulates pain receptors and as a result you see intense pain in the muscles. So this is the basic pathophysiology of muscular pain. There is alteration in muscle sequencing and recruitment patterns also, which causes unaccustomed stress to the muscle and the ligaments around them. The severity is highly dependent on the quality of force that is applied through the muscle. ठीक है, जैसे अगर आप ज़्यादा सीवियर एक्टिविटी करेंगे तो ज़्यादा सीवियर डॉम्स होने के चांसेस हैं. This structural disruption has sufficient evidence on the histological basis, as I told you. Now, what are the basic causes? Number one, if you do a high intensity exercises, high tension exercises in the contractile muscles. Number two, if there is cell membrane damage that I told you, which leaks the disruption of calcium ions. Number three, products of macrophage activity and intracellular contents that accumulate in the interstitium, which in turn stimulates free nerve endings and cause increased pain sensation. Now, what are the symptoms of DOMS? What will the patient feel when we say he is suffering from DOMS? First, there will be muscles that feel tender, even tender when you touch them. Then there will be reduced range of motion due to pain and stiffness. Then there will be swelling in the affected muscles. Muscles will go for fatigue. There will be short-term loss of muscle strength. There will be lots of other symptoms like pain will get peak in 24 to 48 hours. And sometimes you will see the patient is having pain up to 14 days, 2 weeks तक भी pain कई बार रहता है. how can we prevent DOMS? What all could be done to prevent DOMS? How can we prevent it? So first is, we can do a good warm up and cool down exercises. This is the basic thing I would like to suggest. Progression of the exercise should be done as it is indicated. When I taught you about the determinants, then we also read about the progression of the exercises. We should not suddenly increase the intensity or duration of the exercise. Should be done in a progressive manner that will always have an influence in decreased DOMS. Then perform low intensity warm up exercises first and then do the exercises, and after the exercises perform a proper cool down activities. Try to do mild stretching before the exercises so that you lengthen the muscles efficiently for making them ready for the coming exercise and decreasing or preventing the occurrence of DOMS. Vitamin C, E supplements taken every day for approximately 1 week prior to initiation of vigorous eccentric activities has been shown to minimize DOMS. Next thing which is very important, and I always tell my students that they should prescribe this to their athletes, is stay hydrated. Hydration is very important. It is found that men who exercise in hot, humid temperature had a big dip in muscle soreness when they drank water before their exercise. So hydration is very, very important. Then I told you 5 to 10 minutes of warm up. इसमें आप dynamic stretching करा सकते हैं, mild aerobic activities करा सकते हैं, ठीक है. Then cool down. Cool down, a 20 minutes of cool down of low intensity cycling after a lower body stretching training sessions always leads to decreased soreness in the lower extremity muscles. So cool down is a very important factor. Always do the activities slowly. Do not think कि first day ही मैं 30-40 repetitions कर लेता हूँ and then I will be achieving my goal. Do not think that. Take it slowly. That will decrease the occurrence of or prevent the occurrence of DOMS. Now if it occurs, how to lessen the DOMS? Start your program at lower intensity rather than a high intensity. Progress your training slowly. Minimize eccentric actions during your workouts. Increase your protein intake, very helpful. This reduces the basic soreness of the muscles. Okay, maintain these things to prevent soreness. This is very important. Now treatment. Having DOMS is usually a positive sign post-exercise. We always say that it indicates that the muscle is healing into a stronger state than it was before the activity. Hence, it means that the training was indeed effective. We could say that at many times. Many physical therapy patients will be starting a new exercise program or will be adding new exercises to their current exercise program. These high intensities may lead to DOMS. Therefore, it is important to reassure that the DOMS is a normal part and you are progressing it very nicely. Now, first thing you could do is time. You have to give time for the treatment, but you can also take steps to ease the pain and stiffness that is caused due to DOMS. We have seen that some specific self-care steps could lessen the discomfort of DOMS. A number of treatment techniques are there which you could use to ease out the effects of DOMS. First is the massage. According to a review in 2017, it was found that people who received a massage had less soreness than people who didn't get a post-workout massage. To massage your muscles, apply some oil or lotion and then knead them properly. Gently shake your muscles and do a bit kneading and shaking to them. This can ease out the effect of DOMS. Then electrical stimulation. TENS has been found effective in treating pain and muscle spasm associated with DOMS. This decreases the pain content also, and this may not be an accurate indicator of recovery but will have a positive impact on pain. Both pulsed ultrasound and cryotherapy are equally effective up to a period of 48 hours. However, Pulsed ultrasound has an additional effect of increasing the range of motion. Cryo is also very impactful. You could use electrical stimulations that are very effective for DOMS. Then some topical analgesics could also be very impactful. These topical analgesics are products meant to relieve pain. Menthol based topical analgesic trusted on the basis of trusted sources could be used and could have a positive impact in relieving pain in DOMS. Cold bath, a review in 2016 proved that 10 to 15 minutes full body immersion in a cold bath lessens the degree of pain or discomfort in patients with DOMS. It is a popular method for exercises also. Then we could give anti-inflammatory foods. Anti-inflammatory foods could be used. This is very impactful, like you can give cherries, cottage cheeses, baking spices. Turmeric is found to be very effective in milk given to the patients. Then watermelon and salmon is also impactful. So in summing up the easing methods for DOMS, you could ease them with antioxidant supplements, ice baths, massage, recovery rides and foam rollings. That is the rolling techniques you could use. When to seek medical help? If you should go for medical attention if your DOMS lasts more than 7 days, your urine becomes abnormally dark, you have severe swelling in your arms and legs, and then you have sharp pain, muscle spasm and numbness and tinglings. If these things are there, that means DOMS, the causes of DOMS is something different. So you should go and seek medical help as early as possible. So this was about the DOMS. If anybody has any doubt or you want to ask any question, you could ask me, you could contact me on my email ID or WhatsApp me. Thank you so much for today's class.